what I want you to appreciate is the fact that a lower body lift typically only gives you an outer thigh lift. In our practice, we've also added thigh front lift to it, and routinely I'm doing both procedures. But the lower body lift on itself doesn't do anything for the back of your thighs or the inner aspect of your thighs. So to appreciate that more, let's talk about thighs, okay? Thighs have 4 surfaces. You have the front, you have the outer, you have the inner, and the back. And there is one procedure for each one of them. You can have a thigh front lift. You can have an outer thigh lift. You can have posterior or back thigh lift, and you can have inner or medial thigh lift. Those are thigh lifts. Again, lift means vertical elevation. In addition to those 4 thigh lifts, you also have a thigh reduction procedure known as a thighplasty. Some plastic surgeons or patients call it a vertical thigh lift, but really there is no lift there. That's a thigh reduction procedure. As I mentioned, 100% of weight loss patients will have vertical laxity of their thighs. That means that every weight loss patient typically will benefit from a thigh lift, a vertical elevation and correction of the thigh. Whether that's the outer, the front, the back, and the inner needs to be assessed patient by patient. Half the patients will also require a thigh reduction. That means putting a vertical incision starting from the inner aspect of the pubic area, coming down all the way to the inner knees, and sometimes even passing the inner knees by a couple of inches to tighten the skin around the knees. Through that vertical incision, an elliptical piece of skin is removed, tightening and reducing the width of the thigh. So this is a thigh reduction. This is a procedure that reduces the thighs. So we call it a vertical thighplasty. The vertical is referring to the incision, and thighplasty just means thigh molding or reshaping. So essentially we are reducing the width, the girth, the size of the thigh. So that's a thigh reduction.